welcome back to my channel. I know it's been a while, but I'm here. My name is Terry. I'm a doctorally prepared nurse practitioner, and I'm going to give you guys some tips to help beat the coronavirus. So the news is big right now. You can get all the updates as far as the numbers and thing on your news, but I'm going to give you some tips, okay? So the best tip is, well, first of all, there is no vaccine for the coronavirus. That's number one. You need to know that. And that's important because if we have no vaccine, it's hard for prevention. The second thing is to prevent this. To prevent this, you need to avoid being exposed to the virus itself. And that means you need to quarantine yourself. Self-quarantining is an important tip there. Okay, so what can you do? When you go out in public, you need to distance yourself from people about 6 feet. Okay, so the CDC is recommending about 6 feet, and that's what you should be doing to avoid getting exposed to the coronavirus. Other things, so this is spread by respiratory droplets, which means that if somebody coughs or somebody sneezes and you're in contact with them, you could get that landed in your mouth or your nose, and then you inhale this and it can get to your lungs. That's the problem right there. So that's why the 6 feet is so important. Okay, so the other part is washing your hands. As a healthcare professional, as a doctorally prepared nurse practitioner, you know, washing your hands for 20 seconds is so important with soap and water. So that's ideal, okay? So soap and water is ideal for washing your hands 20 seconds. You can sing the happy birthday song, right? And you could get that done. So the other part, if you don't want to do soap and water, you're not at home, you have to get an alcohol based hand sanitizer. The CDC is recommending 60% alcohol based sanitizer. So make sure you check your bottle that it says 60% on there. The other thing, avoid touching your eyes, your mucous membranes, your eyes, your mouth, and your nose, and all. So basically your face. So avoid touching those areas to prevent, contact from surfaces, and then touching your face and getting infected that way. Basically, people who are wearing masks, if you're not sick, you really shouldn't wear masks. So I would recommend that people who are sick, you're the one to wear masks when you go out in public, okay? If you're caring for somebody who is sick and they don't have a mask on, then you should wear a mask. So that's the whole mask situation, okay? So save the masks for sick people. Well, basically, this is the end of the video. Thanks for watching, and stay safe, and consult reputable sources when you're looking for information. All of this information came from the CDC. This is Terry, your doctorally prepared nurse practitioner, signing off.